Assalamualaikum, I am Aliha Mushtaq and my registration number is 2021 DBM 198. Today I am going to explain the case study of Scrotal Asymmetry in a 2-year-old Angus bull. This case study was published by Journal of the American Veterinary Medical Association in 2024. So let's start with the background. This case involved a 2-year-old Angus bull weighing around 682 kilograms. It was referred to the university hospital for a routine breeding checkup, but the veterinarian noticed a malstructured right testicle. Interestingly, the bull looked completely healthy and his scrotal circumference was normal at 39 centimeters. His sperm motility was also very good with 87% normal morphology. So initially it looked fine, but there were clearly some odd going on with the right side. The next we have is clinical findings. Upon clinical examination, the bull was in good body condition, but the scrotum was asymmetrical. The veterinarian then went for the palpation. The right testicle felt a bit firmer than the left one. The key observation he made was the right epididymal tail. It couldn't be felt at all, while the left one was completely normal, and there was no pain on palpation, so it was not a case of inflammatory issue. Then they performed an ultrasound using 8.5 MHz linear probe. The left and right testicle both showed normal echogenicity with 5.4 to 5.8 cm in diameter. Upon ultrasonographic findings, the left epididymal tail was clearly visible and appeared normal, but the right one was missing. So that confirmed that there was something structural missing on that side. These are the ultrasonographic images. The first and second figure is showing that there is missing right epididymal tail, while the arrows in the figure 3 are showing the left epididymal tail. Based on these findings, the team proposed a few differential diagnoses. The first one was segmental aplasia of the mesonephric duct. It means that the reproductive duct, which was not formed properly during development. And the second differential diagnosis the team made was epididectomy, but it was ruled out because the bull was owned by the same farmer since birth, and if they perform the surgery, it is usually done on both sides. So the confirmatory diagnosis that was made was segmental aplasia of the mesonephric duct, specifically affecting the right epididymal tail. The next we have is treatment and management. Since this case was congenital, no surgery or biopsy were performed. Veterinarians recommended the owner to remove the bull to reduce the fertility and risk of passing the defect to the offspring. But if you want to keep that bull, it should only be used as a terminal sire, which means that their offspring not used for the further breeding. But the owner ignored the recommendation and he sold the bull for limited breeding use, and now there are no follow-up data for the availability of fertility out. The clinical importance that we get from this case study is that this condition occurs in approximately 7% bulls at slaughter. So we need to do ultrasound and palpation for the early detection and preventing the breeding insufficiency. That's all. The reference of the case study is given below. Thank you.